Debaltseve sits halfway between Donetsk and Luhansk, the two strongholds of the pro-Russian separatists. It's back in rebel hands now, following months of fighting, finally falling to the rebels a week after the ceasefire was announced in February. The city has been reduced to rubble. Residents who fled during the fighting have started to return, but they don't have much to come back to. Everything is in short supply, and people here are almost entirely dependent upon aid. Medical supplies are particularly hard to find. This is a mobile clinic run by the international NGO Doctors Without Borders. This van is in Debaltseve every day in different locations, and they provide medical consultations and distribute medication to around 60 patients a day. For most here, it's the only access they have to healthcare.
In places like Debaltseve, where there was such huge damage, then it's incredibly difficult for people to access any healthcare at all. There are no drugs in the pharmacies. The hospitals are closed. They're just not functional. There's not even a health clinic functional apart from the one that we're running in Debaltseve, and I know it's the same in many other towns around eastern Ukraine.
There's concern that the current ceasefire, like the one before it, will fall apart completely, and if fighting returns, the health system could collapse.
Even if the conflict restarted, we would try and continue accessing the population. But it's really the very basic minimum we're starting to provide here. And if there was a problem with access to the areas, with supply of medications, then I think that would completely disappear. So we're really on a fragile health situation right now.
For those still reeling from the last round of fighting, the idea that war may once again descend on their city is too much to bear. Kate Parkinson, CCTV, Debaltseve in eastern Ukraine.